I'm here with Rich Askey. He is the president of the Pennsylvania State Education Association. Rich, can you tell us a little bit about the association and what you guys do?
Right. Well, we are the union for teachers, for paraprofessionals, learning support professionals, counselors, everybody who works in public schools, and we represent them. And we also advocate for what's right to happen in public schools.
So recently, Governor Wolf signed an interim budget that covers the next 5 months. When we're looking at education in the budget, what did Governor Wolf put into action for the rest of the year?
Well, Governor Wolf and the legislature both, we're grateful to both groups because they gave us a year's funding, and that funding is the same as this previous year. So we understand with everything that's going on that it was a difficult decision, but it was the right decision because we have schools opening up in the fall and they're going to need resources more than ever. So we're very, very pleased with the action taken by the legislature and Governor Wolf.
Now, how is this money that has been allocated to education being distributed between maybe some higher education, but for you specifically, maybe our basic education K through 12?
I don't have the specific numbers with me right now, but the majority of it goes to our K-12 schools. There is some funding for special education. There's funding for higher education. There's a lot of different areas. There's some grants in there and things like that just basically cover K-12 and higher ed.
Now, especially as we are in the time of a pandemic, how important is it to fund things like education?
It's essential right now. I would say one of the lessons we've all learned is how important schools are to the economy and how we want to make sure that moving forward, our schools get the funding we receive. That's why the state budget is so important. You know, school districts, I will tell you, basically is a tale of two budgets. You have your state funding, and then you have your local funding, which is now the concern because the Pennsylvania Association of School Business Officers are predicting a $1 billion shortfall in local revenue for school districts in Pennsylvania. So that is a problem.
Now, where is this loss in funding coming from?
Well, it's mostly in local income taxes and other kinds of investments that school districts make, other places where they earn some money, and that's the concern. They're just not going to be bringing in the money, and that's a lot to make up. You know, they could cut a few things here and there and use some revenues, but it's not going to come close to making up for $1 billion.
So you mentioned this loss of around $1 billion. How else have school districts and these schools been impacted financially by the pandemic?
Well, so far they are looking at what we are talking about, the loss of revenue. That's the big place. So that's why we're looking to Congress right now to help make up that shortfall. We're joining educators across the country, really, and parents in encouraging the Congress to step up and help fund our public schools. We're looking at asking $175 billion total from the Congress for next year for funding for our public schools. And if $1 billion of that comes to Pennsylvania, that's going to make everything so much better for the supporting of our students and our communities and keeping our economy going, as we've learned.
Now, what have been those big challenges that these schools, these school districts, the teachers and students in these schools have been facing during the pandemic?
Well, I mean, just not being in the buildings. I will tell you, the members of PSEA have been devastated that they have not been able to make to be in the buildings with their kids. The good news is that teachers were still teaching, students were still learning, and it was just amazing to watch how everyone just stepped up and made that hard left turn right away to step up and keep kids learning. And I think it's especially hard for them right now because they want to be there to say goodbye to their kids for the year. the folks that are teaching the seniors, they want to be there to cheer them and say, yes, you did it. And they're not there. I mean, it's kind of emotional for all of us right now. And it's emotional for parents and the community. This is a time we celebrate successes. And though they still had those successes, we've had to change the way we celebrate them.
Now, as it is the ending of the school year this year, and as we look ahead to September and a new school year, how are schools looking at reopening, and what plans are they making to make sure that the students, the teachers, and everybody in the building is safe?
Well, I know we are working with other state associations like the school boards, school business officers, school administrators, and of course we're having discussions with the Department of Ed also to get those plans going. People are working their tails off, I will tell you right now, to come up with the plans. I don't think everybody has all the answers, but we're working hard to get the answers. And we're going to be looking at things like social distancing. We're going to be looking at PPE. We're going to be looking at transportation, feeding, perhaps schedules that are scattered throughout the day, where you bring someone in part-time, you bring in students for a few hours a day. There's hybrid methods of learning we're looking at, where there's a combination of online learning and in-place learning, so that we limit the amount of students that are in a building at the same time. So we're working very, very hard, and there's a lot of people working hard to get those answers going, and so we can do the prep work. After all, it's June. You know, August is going to be here before we know it.
What are the biggest wants and needs of these schools to make sure that they are able to open fully in September and make sure that they are educating Pennsylvania kids?
Well, the biggest one they have is to make sure they have the resources they need, which is one of the reasons why we need the funding from the federal level to help. We need the nurses. We need the social workers. We need the psychologists. We need bus drivers and cafeteria workers to help scatter those kids and make sure that can you imagine putting 300 kids in a cafeteria together right now, what that would mean? So there's things like that we need, and that's why the funding from Congress is so essential.
Have there been guidances from either the Wolf administration or from the federal government about how to start reopening these schools and how to keep the people in those buildings safe and make sure that, we're not spreading this pandemic?
Well, the CDC came out with some guidelines, but their recommendations, their suggestions. So now, as I said, the work is being done. I know that I believe in the next few days, we're probably going to hear something from the Wolf administration on some recommendations. And we're also going to be hearing shortly from those other groups that we're working in tandem with to make sure we have the best possible situation to support our students and the people working in the building and the community, because I always say a public school is a hub of a community. So you have to make sure that building is safe for everyone.
And final question, how are you working with the members of your association as well as other stakeholders who work in a school district to make sure that everybody is feeling comfortable and that everybody will be safe when schools eventually do reopen?
I'm so proud of how we've been communicating with our members. We've been, I think just like you, I think we've all become Zoom experts in the past, few months. We have had webinars with our members and sessions with our members about online learning, about well-being, because our students are going to need well-being. Plus, the faculty is going to need some well-being sessions too. So we're looking at every factor that we possibly can to support everybody in the building.
Rich Askey, thank you so much for your time.
Thank you.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm here with Representative Matt Bradford. He's a Democrat representing Montgomery County, and he is also the House Appropriations Minority Chairman. What has the impact of COVID-19 been on your district?
Well, I think first and foremost, it's a human toll. I have Einstein Montgomery, which is a large Montgomery County hospital that's seen countless number of COVID patients. Obviously, COVID has played a particularly impactful and negative role on our long-term living facilities, and I've had several of them had numerous cases. Montgomery County obviously was hit earlier and harder in many cases than a lot of our other counties. So it's been devastating on a human impact. My kids' friends have their parents have been impacted, young and old. I mean, it's in Montgomery County, we've really seen the face of what can be a pretty nasty disease.
Now, as Pennsylvania is slowly reopening, where is Montgomery County in Governor Wolf's reopening plan?
So as of today, Thursday, we're still in red, but tomorrow it's expected that we will move to yellow with the most of the Commonwealth. So this is a long expected. People are going a little stir crazy, and we appreciate that. But more importantly, for a lot of our businesses who've suffered and felt the pain and really have been very responsible at a time when it's been very difficult. So this is a real lifting of that, and I think it makes people recognize that we've come a long way and we've saved a lot of lives in doing this. But we have real impacts, and we need to get through that, and we need, as a government, to be a partner in helping our business community get back on its feet.
What have you and your office been doing to help support the constituents that are in your district?
Well, you know what, like everyone, the unemployment has been a big issue. Obviously, that system just got a tidal wave of claims. So helping people navigate through that, people who were self-employed, gig workers who've never had to file before, never had the ability to file before, helping with that. Getting people information, not just constituents, but business owners, what they can and cannot do. People want to do the right thing, but they also recognize that it is a whole new thing. No one in a million years thought they'd be dealing with a pandemic. So we've had everything over the last couple of weeks, and been happy to try to serve our constituents the best we could.
Now, you're also the minority chairman of the House Appropriations Committee. How did COVID-19 have an impact on this year's budget process?
Well, it's been a budget process like no other, right? That goes without saying. It just decimated revenues. At the same time, demands on government in terms of expenditures have never been higher. People need government right now to be a partner, to help them. So you have a budget that's completely out of whack. We recognize, because of the pushing off of tax deadlines and stuff, a lot of the money that would have otherwise come in this fiscal year has been delayed to next year. So we have a budget that's about $3 billion plus out of whack for the current year. That, unfortunately, those revenue issues, we don't know fully what that'll look like next year, what this recovery looks like. Do we have this V-shaped recovery where everything jumps back and the light goes back on? Or does the economy open into something much more like a recession? So there's a lot of variables and unknowns in this. And I think that, kind of sets the stage for why you see a 5-month budget this year, which, is not a perfect situation. But there is some recognition there that you need to bridge over to hopefully better economic times where our economy is back open.
How does the Appropriations Committee balance those losses of revenue that the state is currently seeing versus the need of the citizens of Pennsylvanians?
The simple answer is help from our federal partners. When you deal with a challenge this big, this large, this impactful in this short a period of time, without federal assistance, state governments, city governments, county governments can't deal with it. One of my concerns, frankly, with the budget that was just passed is I think my Republican friends are largely relying on Speaker Pelosi's bill to move out of the U.S. House, which would give aid to states and local government. Without that federal assistance, it is going to be a brutal several months ahead for the Commonwealth.
Are there any things that you or your caucus in the Appropriations Committee would have liked to have seen in the budget that was just passed?
You know what I kind of wish for, and again, I realize these are challenging times, and I give all the credit in the world to our governor, who's done just an amazing job with an intransigent legislature for some time, is more of a coming together and a recognition of these bigger challenges. You know, we punted off 5 months, but I fear as though we punted off without a real discussion of what comes next, right? If you're going to do emergency things like this, out of the box things in order to buy time, let's begin the discussion about what comes in November. I fear as though some push this off, whether it's after a next election or after, to buy 5 months. We need to have honest discussions like yesterday about how we're going to fill that hole. The budget that my Republican colleague left us with has about a $5+ billion cliff. Funding cliff, and really, other than a federal savior, I'm not sure they have a great answer as to how they want to fill the back end of that budget.
What were the major priorities for you and your fellow Democrats in the Appropriations Committee when it came to looking at this budget?
Yeah, so in my caucus, obviously, one of the bright sides, and I think is to the credit of the governor, is making sure we have a year of funding for education. Now, again, it's flat funding, so no one should get carried away. But in this economic state that we're in, flat funding for a year, I think, gives some stability to our school districts. Another victory, I think, for House Democrats was the ability to make sure that the property tax relief money, in some cases that's over $300 for every property taxpayer in the Commonwealth, was restored. That money in the original budget proposal was not going to be there. Many in our caucus raised real concern that was an immediate property tax increase on Pennsylvanians. And frankly, this is the last time in terms of our economic situation that we should be raising property taxes. So making sure that property tax relief money was there. I think the education and the property tax relief are the two things that we take away as priorities that were part of this budget.
Now, as has been previously mentioned, this budget is for the next 5 months. So does that mean that there will be another budget process at the end of the year?
There better be. Listen, I, as a person who wasn't an architect necessarily of this budget, I think it is the responsibility of those who advocated for this 5 months to come out there and say how they're going to deal with it. These challenges are going to be massive in November. You're going to have a very impactful election in November. You're going to have a very compact period of time in which to come up with the solution. And you're going to have a historically large budget deficit that this has created. It's created a massive funding cliff in November. So one of the questions that I said at the time on the floor when this budget was passed is, I don't necessarily give the budget an A or an F in terms of grading. I give it an I. It's incomplete. And until those who supported this 5-month budget can tell me how they're going to fund the back end of it, I think they have some serious work to do and some reckoning to do with the people of Pennsylvania as to how they propose to deal with that.
Now, as the House of Representatives was working on the budget and other COVID-19 related bills, news broke last week that a member of the Republican caucus, Representative Andrew Lewis, had tested positive for COVID-19. What was your initial reaction to that news?
Well, initially, and I'm happy to hear that Representative Lewis is doing well. I realized that he also exposed or had some exposure to other members, and it sounds like all of them at this point are doing well, and I'm glad to hear that. So on a personal level, on a human level, we're glad to hear that. I mean, that's first and foremost. Obviously, it's a little shocking. It was a little disconcerting. In fact, more than a little disconcerting, it was disappointing, frankly. That this information wasn't shared. And again, not about individual members. That's not appropriate or necessary. But in this day and age, I mean, the speaker, I think to his credit, Speaker Turzai, came out and took the bull by the horns and said, obviously, he would personally disclose. It is disappointing that in a time of hyperpartisanship, people weren't able to check that at the door and just, put everyone in a better frame of mind of, hey, there's been a possible exposure. We should all make sure we're redoubling our efforts with tracing and such to make sure we're all in a good spot. And, listen, the part without being what worried a lot of us, frankly, is a lot of these same folks are out there advocating for businesses to reopen and have been doing that prematurely, have been doing that for the last 12 weeks. They were saying these things without having their own house in order. And I think that's why in so many editorials they got blasted for, frankly, being so irresponsible and cavalier. I think that is, I think that's what many of us found. So on a personal level, just disappointing.
And where does this leave the House of Representatives as we move further into June and the last couple of House sessions for this year?
So, again, I think we go back to that budget thing. It's not a small thing, that budget cliff that we have. Obviously, depending on what the federal government does, I think is going to play a big role in that. But continuing to watch that, we're going to have some session days, I know, in June. And probably break until September. I think we're all going to keep our fingers crossed and say a prayer that COVID doesn't resurge like it's been, like many think it might come the fall. So I think a lot of variables are still at play that aren't frankly in control of the legislature in terms of federal action, in terms of the virus. These are all going to play a big role as to how the next few months play out here in the Commonwealth.
Representative Matt Bradford, thank you for your time.
Thank you, Kes.
During the uncertain times brought on by the coronavirus outbreak, PCN remains committed to the needs of Pennsylvania and its people. PCN provides free daily coronavirus updates from Governor Wolf and the Department of Health Secretary Dr. Levine, live, on air, and streaming on the app and online. These updates will be available to watch in their entirety on demand for free by downloading the PCN app or at pcntv.com. PCN, committed to keeping Pennsylvania informed.
I'm here with Ann Henry. She is the Senior Vice President and the Government Affairs Officer at LeadingAge, Pennsylvania. Ann, can you tell us a little bit about your organization and what you guys do?
Sure. We represent not-for-profit long-term care providers, anywhere from nursing facility care to home and community-based service care, independent living, retirement communities, affordable housing, really the full gamut of long-term care and senior services. And we represent those folks primarily in Harrisburg, every once in a while on the federal level, but primarily on the state level.
And how have the organizations and the places that you represent been affected by the COVID-19 pandemic?
Yeah, it really varies. Really depending on the area of the state they're located in. So we have a lot of members in the Southeast and Northeast and parts of central Pennsylvania that have been hard hit with COVID-19. And then we have some folks in the center part of the state and the western part of the state that have seen less cases.
Now, for those facilities that have been hit hard by COVID-19, what have they been doing to stop the spread and to keep the rest of their residents safe?
Yeah, so they've really been following all the guidances, whether from the Center of Disease Control, the Center for Medicare and Medicaid Services, the Department of Health, or for personal care and assisted living, the Department of Human Services guidances. They've been attempting to cohort the folks who are positive, screening staff every day, beginning of shift, end of shift, utilizing those personal protective equipment that we've heard so much about, and to the degree that it makes sense for their building and there's availability, they're testing both their residents and their staff.
Now, what makes facilities like this so vulnerable to a pandemic disease like COVID-19?
Yeah, so people who are living, especially in nursing facilities, they have usually multiple diseases, comorbidities, before they ever enter the nursing facility. So they're already in a weakened state. Usually they're elderly and very elderly. Sometimes they're 100 plus years old. So they're already in a weakened state. And then when the virus comes into the building, and early on it was likely by staff, or maybe even by visitors before we had to eliminate visitation, then it really runs rampant, unfortunately, through these buildings. And we've learned so much over time, as has government, on how you actually deal with the disease and how you really try to limit people from coming into your building and how you really do screen anyone who enters your front door.
What are some of those things that LeadingAge PA as well as the Wolf administration have learned about helping to control this type of virus?
Yeah, so we've really learned a lot about personal protective equipment and the lack thereof. And we've spent a lot of time. We actually have someone on our staff almost 100% dedicated to finding PPE for our members. Now we're actually turning around and working to try to help them with testing. There's been some new guidances out from the Department of Health on how to test both your staff and your residents, which is great. It's great to have the guidance, but there's a lot of barriers to testing, including the availability of the testing. So we keep changing as our members' concerns keep changing.
And what have some of those main concerns been of the members of LeadingAge PA?
Yeah, so there have been a few. I mean, certainly the PPE, the cost of the PPE, the cost of staffing. So what we've heard from our members is the first time you have a COVID positive, whether it's a resident or a staff member, we really hear about staffing challenges. And so we're paying, or our members are paying, extraordinary wages and different kinds of benefits and perks so that staff come to work. And then, of course, early on when you couldn't find the PPE, staff were just afraid to come to work. Fortunately, that has gotten so much better. But there's just been a lot of extraordinary cost, and everything just keeps changing and altering as this pandemic continues.
What are some of the actions that your organization is taking to help support those facilities that you represent and that you represent?
Yeah. So as I said, we do have someone on our staff who is really dedicated to attempting to find PPE. We actually have collaborated with PIMA and another organization to bring PPE from China. We were actively advocating for CARES Act money, and of course the General Assembly and the governor came through for that for us last week. And now we're really working with both the Department of Health and Department of Human Services on testing and then reopening strategy. We're really concerned as counties go to green. Actually, Department of Health just today issued guidance that even when your county goes to green, in all likelihood, restrictions on visitation and some of those kinds of things in nursing homes will likely continue for at least 28 days more. So we're really trying to work with the various state departments to understand what their thought process is and then educate our members.
Now, you did mention CARES Act funding. Can you talk about what that is and why it is so important to have that type of funding for nursing homes and long-term care facilities?
Yeah, so the CARES Act is a federal act, and it's funding for COVID-19. So Pennsylvania, I think we got a little bit over $3 billion, if I'm thinking correctly. And so we were really urging the General Assembly and the governor's office to make sure that nursing facilities, personal care homes, home and community-based services, all of those really on the front lines of this disease, have some money from that CARES Act to help with all of the various costs associated with this disease. So I mentioned PPE, the testing, the payments to staff, and then there's a variety of other things, including cleaning supplies, so all new cleaning supplies that are going to kill the virus and those kinds of things.
What has been the financial impact on institutions and facilities like the ones that you represent?
Yeah, so it continues. I mean, as the pandemic continues, those extraordinary costs continue. And while there have been federal tranches of money that were pushed out to nursing facilities, and now the CARES Act money that I know the state is rapidly trying to get out to providers, those cost strains continue. So in addition to the ones I talked about, there's losses of revenue. So as nursing facilities either aren't able to admit or People are unwilling to come to nursing facilities or personal care or assisted living because they're fearful of moving into that environment right now. We've seen losses of revenues, and then the cost of liability insurance has also increased. So those are the kinds of costs that we see continuing, and we're not quite sure when they'll end.
And what would you say is the importance of funding these types of facilities to help the older Pennsylvanians here in the state?
Yeah, so it's really important. I mean, we all would like to stay in our home till the end of our life. Sometimes it's just not possible. So when that is the case, to have a really good quality nursing facility that you can send your loved one to is important, but it's expensive to run a nursing facility. Staffing is our largest cost, but then of course this virus, there have been those new added costs we've already discussed.
And you did mention earlier that you were working with the Department of Health. How else are you working with the governor's administration to make sure that all of the nursing facilities and long-term care facilities are following these specific guidances that they should be following as we slowly begin to reopen the state?
Yeah, a lot of it's really been communication. We've been very fortunate that we have really good relationships with the governor's office and with the Department of Health and Department of Human Services. And so when we know of needs, whether it's one particular facility or our membership in general, we've been able to reach out to those folks, have conversations, and try to come up with plans that are going to work for everyone.
Ann Henry, thank you so much for your time.
Thank you.